Hey, good afternoon, everyone. I'm delighted to be able to join you. My name is James Hodge, and I'm the director of the Western Region Office here at Arizona State University at our Sandra Day O'Connor College of Law. So welcome to our session. Here's what we've got in mind for you. Let's do some very brief introductions. I've got three fantastic attorneys from our Western Region Office to briefly introduce you to, and I'll be working with our moderator, a very new colleague of ours, Jen Pyatt, who I'll introduce you to in just a second, for what we'll do in regards to assessing some of the core legal issues that we can address in the Western region on all sorts of fronts, COVID-19 related. I will take with all of our attorneys here a very interactive session with your questions, your comments. Our objective is to address those questions in whatever real-time fashion that we can. Here's my promise to you: if we do not have the answers for you or good information today, we'll get it. So what I would hope you can do afterwards, if you didn't get what you were looking for from us in regards to our interactive Q&A today, email us at any of the addresses you'll see towards the end of our screen here in just a second, and we will address those in real time later as well. All right, without further ado, one final note: as with all of our network technical assistance efforts, hey, just remember, nothing we'll discuss here today is specific legal advice. We can't provide it through our foundational funding with the Robert Wood Johnson Foundation. We're not attempting to to draw that line. Anytime you need specific legal advice, of course, consult your legal counsel. We'll get you good information, and we'll, of course, be happy to talk to those legal counsel if we're not speaking with you already today. But just remember, nothing here is legal advice in regards to our session. So we're broadcasting live today from our headquarters here in the Western Region Office. All of our blue states you see on screen constitute the Western Region. Listen, I don't care what region you're sitting in right now. If you're on with us with this specific session, you are entitled to ask us any questions you'd like. But because we do address questions on emergency preparedness with COVID-19 all across the country, and to be sure, you're in perfectly great shape asking us anything you would like. We're based here at the Sandra Day O'Connor College of Law right here in downtown Phoenix, and delighted to be able to join so many colleagues from out west, but across the country as well. If you don't know about this resource in relation to where a lot of our information stems, so working with our network national office, our great colleagues across our network, we routinely provide information and updates through what we call a legal preparedness primer. And this document, though kind of built around a series of PowerPoint slides, easy to follow, easy to navigate, often provides answers to questions even before you even think they're questions to ask. But to be sure, it's a resource you may see one or more of us turn to, not to show you what's in the primer, but just to remind you there's really good information there as well. We also have a whole slate of great webinars, and while we can't get into all of these topics today, about local government responses, reopening efforts, constitutional issues, we've addressed it all in now recorded webinars that appear on these specific dates on the network website as well, along with a lot of additional material. All right, let's get right to it, shall we? I am delighted today, and I'll turn over the podium here in just a second to our great new colleague, Jennifer, or Jen Pyatt. Now, she's joined us now as a research scholar here at our ASU Center for Public Health Law and Policy. She is also a senior attorney now with our Western Region Office. I mean, literally, this is like Jen's second day, but she's got extensive experience working with us, both as a researcher before and as well as a senior practicing attorney within the Phoenix community. So I'm delighted now to turn it over to Jen for brief introductions, brief topical walkthroughs with our two additional attorneys. Jen, it's all yours.
Thanks very much, James, for that introduction. Everybody, it's wonderful to be with you today. Thank you so much for joining us for this question and answer session. You already heard from James, but I will go ahead and introduce him as well as our other speakers. James G. Hodge Jr., JD and LLM, is a Peter Kywit Foundation Professor of Law at the Sandra Day O'Connor College of Law at ASU, as well as the Director for the Western Region Office of the network. We are also joined today by Leela Barraza, JD and MPH, who is an Associate Professor at the Mel and Enid Zuckerman College of Public Health at the University of Arizona, as well as a Senior Consultant at the Western Region Office. And finally, we are joined today by Sarah Wetter, JD and MPH, who is a Fellow at the O'Neill Institute for National and Global Health Law at Georgetown University, and who is also a Senior Consultant at the Western Region Office. And with that, I will go ahead and turn it back to James, who will begin to take us through the primary topics of this question and answer session, though he did note initially that all questions are allowed, so please don't hesitate to ask them.
Great, Jen, thank you. And we'll be looking for those questions in just a moment. Why don't you let Leela and Sarah me just give you a sense of like some of the topics that we have addressed and been handling in real time all throughout this COVID-19 pandemic. These are some, these are not all, but these are ones that might help as far as establish some of the types of questions that you're going to be potentially asking. But as Jen noted, everything's fair game in the Western region. So I'll hone in on the 2 red questions or red points. Leela, I'll turn it over to you for your points in regards to some of your great work on the blue bullets here, and then we'll turn to Sarah again for some of the purple topics as well. I'm going to be brief, we're going to get right to the point, and I'm going to assure you of a couple things in relation to what we'd love to hear from you. Our questions related to the scope, extent, and duration of these federal, state, and local emergency declarations and powers. These efforts have been, as you have heard me say multiple times, completely unprecedented. And they are ongoing for the potentially longest duration we have experienced in this sort of national phase of emergency response efforts. They're ongoing for the last 8 months. They will likely continue for months to come. Where is this taking us? What are the real legal issues now and in the future? Where have we been? We are prepared to address any of those specific questions, working very closely, for example, with the National Governors Association regularly on some of the most updated information on these fronts as well. I think one of the things that we're experiencing in real time, I mean, literally coming into this Q&A session, we had to brief on a case out of Pennsylvania because we watch all of these developments across the country, whether they're Western region focused or not. It's the constitutionality of what you're seeing. So we put enormous efforts into studying these issues. We've seen literally it all, including this new decision out of Pennsylvania that literally flips the Constitution on its head in relation to key public health prevention and opposing arguments. We'll be delighted to address any questions you may have to that front. I look forward to several good observations to that end. Leela, over to you on some of your efforts on vaccination and related airport preparedness.
Thank you, James. I'll be brief because I'm excited to hear all the questions that all the participants have today. But some of the questions we have been addressing in the Western Region office that I've been focusing on have been related to school reopenings, which is a big area of questions right now. And one specific area of focus related to school reopenings has been around vaccinations and what the impacts COVID-19 has had on vaccination policies across the country, in certain school areas, and what that looks like for students coming back into their classrooms for the upcoming school year. Another area is around legal considerations for airports. We live in a world now where plane rides, everyone's just a plane ride away from another country, another city, and there's real legal considerations for airports to think about when they are making communicable disease plans. And when they are, in those planning stages, unfortunately, we are in the throes of the pandemic now, but, airports can still make changes in plans now and then for the future, make changes to those plans as they see fit based on what's happening right now. Sarah, I think I'll pass it to you.
Thank you, Leela. I'll also try to be brief to keep most of our time for the Q&A. But first, one issue that we'll be talking about is crisis standards of care. And as we saw COVID cases really surge across the US, we saw a number of states activate crisis standards of care plans. And there's legal challenges have emerged related to those, including the coordination of services, allocation of resources, particularly in a non-discriminatory manner, issues related to reimbursement and licensure or the authority to waive licensure requirements during an authority, scope of practice, accounting for patients' interests like advance directives, the duty of care that providers owe to their patients in a uniform way, and also employer duties to protect their employees who are working in a healthcare setting by providing them with PPE and the proper protections to be able to go to work safely. Definitely one thing that was a major concern during COVID was the allocation of limited ventilators. And the plans that states came up with to make those decisions on who to give limited ventilators And oftentimes those plans were based on the likelihood of both immediate and long-term health outcomes, taking into factors such as age, disability, the presence of comorbidities, which led to a lot of disability rights related challenges. So we will talk more about that in the Q&A. But turning over to preemption. Preemption refers to the ability of a higher level of government to pretty much override the legal authority of a lower level of government. During the pandemic, we saw a lot of issues both between federal and state governments and also state and local governments. There was a lot of talk whether at first there would be a national lockdown, and then in regards to reopenings, whether the federal government could override state reopening plans and require them to reopen sooner than they had planned. Which would have raised a lot of federalism concerns, as state governments do hold those police powers to protect public health. And then also between state and local governments, we did see states preempt local authority during the pandemic to issue different reopening requirements than what we saw coming out at the state level. So the removal of local authority in that sense could be dangerous if locals are kind of removed as a layer of protection against the pandemic and are unable to issue things like mask requirements or stricter reopening requirements. So I think now I'll turn it back over to Jen to get us started with the Q&A.
Great, Jen. Before you do so, and I'll turn over to you in just 1 second, we did not have a chance, with apologies to our audience, to do our full audio checks leading into this session. So Leela, just to note, maybe if you're a little closer to the mic next time, we got a little reverberation on your comments, and I want to make sure everybody gets the benefit of Leela's guidance as well. All right, Jen, so we turn it over to you. Take us into our questions and comments, where our promise to everybody is we'll be as brief as we can to respond and get to as many questions as possible. Jen, what do you see?
Thanks very much, James. Please, everybody, if you have questions, go ahead and submit them through the Pathable chat function. If you have a specific attorney that you want to speak on that point, you can also indicate that as well, and we will go ahead and dive right in. I also have a second screen that I'm using to monitor the chat function, so if I turn, that's why. I do see a primary question in the chat from Timothy Flood. If a mandatory mask order is issued and people don't comply, what recourse is left to enforce that order?
I'll be happy to address that, but as with many of these great questions, you may hear from Leela or Sarah as well, and Jen, any comments you've got to that effect are good too. Let's be very clear about this. Some states are taking a very heavy-handed approach and others less so. So what you're seeing across the United States in regards to mask requirements, absent, what you're seeing at the federal level with a little bit of an absence of really strong guidance about what should be done and what sort of mandates could be forthcoming, you are seeing some states take it extremely seriously, issuing fines, issuing, on the street violations. In New York City, for example, they've made it quite clear, if you do not wear your mask on the subway, you're going to be fined on the spot. And this is going to be a, confounding sort of issue of just how far some jurisdictions go. Tim, honestly, what I think we're really seeing in regards to the mask requirements is that even though we know these flat out work, if you can't put a condition upon participation in society based on a mask, it's harder to make it stick. So for example, in university settings, like what we exist in, hospital settings, other places, condition of entry, condition of participation, condition of going back to school, you will wear a mask. That's working well in the United States. General day-to-day wearing the masks on the streets of multiple communities, very hard to enforce, and we've seen a lot of difficulty and contentiousness legally across jurisdictions with lawsuits to follow as well. Leela, anything to note there, or Sarah?
No, I think we've seen, I know Connecticut announced recently that they would start doing fines as well, so I think that's, it seems to be that for a lot of the jurisdictions are going with that fine, but it does, as you mentioned, it does vary.
I agree. I think James and Leela, you did a great job of covering that and the difficulties of enforcing it, especially without some type of hook available. So I'll turn it back over to Jen to see if we have another question.
We do have another question that kind of piggies off of the same mask topic from Sharon Everett. Are any jurisdictions requiring masks to be worn properly? Are people fined as if they aren't wearing a mask if they're wearing it improperly? Is there a consistent definition of wearing a mask?
Great point. And to that end, yeah, I love it. I wish I could put my mask on right now and show you, of course, the distinction. But the reality is, yes, wearing a mask improperly under some jurisdictions sort of requirements or mandates. And a lot of these are showing up in local governments, right? So we've seen the city of Atlanta get into a real legal battle with the state of Georgia, Governor Kemp over that specific issue. You know, wearing a mask is not about simply having it. It's more about properly placing it and using it in the specific settings. And that a half-done mask with the nose exposed or kind of laying down by your chin is obviously not sufficient. But we're still seeing, you know, considerable leeway. We're in an environment where people are still unsure, and some localities and jurisdictions are unsure of exactly what the prototype mask should be to require. That's become very clear through CDC. The guidance on what masks are safe, what works better is right out there. But to be sure, it's often, I think we've seen the case with some persons literally objecting to masks solely on the basis of they brought one, they refused to wear it up to the full extent of what localities would like to see. As I was noting earlier, in specific settings where condition of participation is made contingent on mask wearing, they're, you know, able to be a little bit more of a stickler on what and how masks should be properly worn. But in public settings, parks and mass transportation, and potentially even airports as well, where we may not be monitoring as closely for every single moment in which a person is participating, we really do rely on persons' civic responsibility to engage and use that mask fully for both their own protection and the protection of the persons around them. I'm seeing, I think, at least most Americans complying, but sometimes most won't cut it in relation to full protection. Anything else to add on that, Sarah Leela?
I think, like you said, James, there's so much guidance out there from both CDC and at the state and local levels about the proper way to wear your mask, that in enforcing a statute, they could kind of rely on the fact that such guidance is so readily available. But at the same time, I think enforcing it really does kind of rely on that civic duty, and we're more likely to see people asked to fix their mask or wear it correctly than probably result in any kind of penalty for incorrect mask wearing. But it's definitely a big issue, because even walking around in DC, I see all the time people have it or just around the lower half of their face. So thank you for that question.
Yeah, it's a good point. Excellent. Jen, back to you.
Sure thing. I have a question here for Leela from Brenda McIntyre, and she asks, how feasible would it be for school nurses to start doing student vaccinations? Mm-hmm. Brenda said she has been looking into becoming a vaccine coordinator to start an on-site flu clinic at the school because of the pandemic hitting the reservation hard, and that we could protect more people and immunize more of the community and children if able to do something like this.
Great, thank you for that question. Can you hear me okay?
It's pretty good, Leela. Maybe if you're a little closer to the mic, just to make sure we're limiting the reverberation.
Sorry, yes, we weren't able to do an audio check, so sorry if it's not ideal, but I'll be as close as I can to the microphone. That's a really great question, and one area that we've looked at in the Western region is, unique ways that we've seen in communities that to increase the vaccination rate. We know that the vaccination rate amongst children is lower due to this pandemic for understandable reasons that parents have been concerned to go to the doctor's office or their local health practitioner and get vaccinated. So one way we have seen communities do that is do drive-through clinics or do on-site clinics at schools or community areas where a lot of people could come and get their vaccines. There are obviously some legal issues that have to be considered based on, what's allowed for a practice in your state, which we can, specifically look into some questions for you if you have some specific questions. But the general, regard is that has been done in some communities. It just depends on some nuances, perhaps, in practice laws and certain jurisdictions.
Yeah, and Leela, that's the type of question, Jen, thank you for bringing it to us from Brenda, but Brenda, that's the type of question, like Leela's answer to that was great. If you do have like very specific jurisdiction type of information you want to know, email Leela or me or any of us on screen at the bottom. You see it, our address is there. And that's the type of thing we can follow up with, like specific Texas state law provisions or, what we're seeing in California or otherwise. So not a bad way to follow up on those fronts too. But Jen, we've got more questions. Go for it.
Sure thing. I'm gonna reiterate my call for questions in the Pathable chat, everybody. Oh, I see we just got another question from Anthony Lee. And his question is, if an essential worker is in close contact, i.e. within 6 feet for more than 10 minutes, with another person who has tested positive for the coronavirus, are they exempt from local quarantine requirements? If so, that would seem contrary to protecting public health.
Gosh, that's very interesting and somewhat generalized. So we don't exactly know the setting. For example, it makes a big difference, I think, in regards to some of that as to exactly what type of essential worker we're talking about, if it's a healthcare worker or otherwise. Second, the actual setting. Is it indoors, outdoors? What's the specifics of it? Some of that makes a difference too from just a pure epi perspective. But let's be clear on at least the general guiding principles for quarantine and or isolation that we're really trying to work hard to still adhere to despite all of the challenges over the last several months of trying to assure and get from Americans the type of civic response we need to actually keep within social distancing COVID in its tracks as we basically wait for that vaccine to try to allow for this. Here's the dilemma we run into. When you have mass spread of a particular condition like COVID-19, we cannot simply expect home quarantine or home isolation for everybody that's been exposed in any specific setting at any point in time. There just would be too much expectation there and too significant of an impact on everything from economic purposes to just mere enforcement. But I do think what you were highlighting there that was interesting to me is you've really seemed to hone in on the essential worker facet of it as to whether or not this person whose efforts are so essential that we really must have them. And so whether or not they've been exposed in regards to COVID-19 or not. Let's assume they were exposed. And the question is, would we not automatically quarantine that person? Well, honestly, let's say in the healthcare worker setting, we're just merely responding to what we're seeing in real time from a healthcare perspective has been absolutely phenomenal. There are actually calls to basically say, for our purposes, we've seen, so long as you're asymptomatic and so long as you can still provide healthcare services, from a legal perspective, we're going to ask you to, whether you're exposed or not. Now, the moment of which you actually cannot engage in universal precautions to limit that specific exposure, or you become symptomatic such that it may impact your performance, of course, step away. But we've seen recommendations like that and have been legally sort of upheld or buttressed by the sheer fact that those healthcare workers are that essential. We cannot lose them just because on a given day, in a 10-minute period of time, they got exposed to somebody. Now, that's happening all across the country in healthcare settings across the board. Maybe that gives you a little bit of more context there, and I hope that does to that end. But Sarah or Leela, anything to add along those fronts as far as how we think that through in different contexts?
I was just thinking it through in the context of even earlier in the pandemic when some hospitals were really starting to see those surges in cases, and there was a lot of healthcare workers who felt like they weren't being properly protected within their job settings because they simply didn't have enough PPE for everyone to wear. And in those settings, it was likely that they were being exposed to the virus as more cases were coming in through the doors. And a lot of questions came up on whether hospital workers had to go to work or whether if they felt like they needed to be in quarantine. So there was a lot of issues because at the same time we need healthcare workers to take care of the surge in patients, but at the same time we need to protect those healthcare workers and then the people that they're around too. So it was definitely a challenge to our system and showed really the need for hospital planning for surge to try to avoid that shortage of PPE in the first place.
Yeah, Sarah, you're right. And one of the other additional follow-ups that I was just thinking about, because your point on the healthcare workers and how much we had to counterbalance that, we really have seen fluctuation in the implementation of quarantine isolation measures across the United States, very dependent upon populations. And by that, I mean subpopulations, healthcare workers as essential as contrasted with non-essential persons in non-essential settings. So that has been one of the most divisive and most interesting legal issues we've seen. I hope that gives you a good answer. I think it was Everett that we heard that from Jen, but do let us know if there's more clarification we can give you on that specific front. Jen, what else is rolling in that you're seeing?
Sure, thanks for those answers, everybody. I am going to go ahead and pose a question to Sarah that I think is very interesting. Sarah, could you please explain the role of tribal governments, especially where those laws conflict with the federal government and the state where their land sits? What might be long-lasting implications of the battles relating to reopening casinos, reopening communities, travel restrictions, et cetera, during COVID? And how can tribal leaders work with state and federal officials to align those interests and better protect public health?
Oh, Sarah, you're still muted. There you go.
Sorry. Thank you for that question, Jen. Well, first off, to answer the first part of your question, since tribes are sovereign entities that have their own laws, on tribal reservations, members of the tribe, they're not subject to state law. But at the same time, persons who are not members of the tribe are still subject to state law when on that land, and tribal members are subject to state law when they're not on the tribe. So this, during COVID, really created a conflict when the tribe's plans for reopening or shutting down didn't align with that of the surrounding states. I'll give you a couple of examples to kind of highlight the conflict. A big one was with travel restrictions and travel checkpoints. In South Dakota, we saw the Cheyenne Sioux River tribe initiate checkpoints going in and out of their tribe. And they had a really good reason for doing that. They have really limited healthcare resources, very few ICU beds, very few ventilators. So if COVID hit them, they would be having to send people many miles out of the tribe just to receive healthcare once their own resources ran short. So the goal of that was to really keep the virus out of the tribal lands by initiating these checkpoints. But the checkpoints were on state and federally owned roads. So there was a big challenge there because the surrounding state, the governor didn't want those checkpoints there. And they said it even violated federal law because it was disrupting interstate commerce and it was on these federal roads. So they tried really hard to remove the checkpoints. And even now there's still an ongoing lawsuit that the tribe actually initiated in June. They sued the federal government, asserting that they were being unlawfully coerced to remove those checkpoints. The federal government threatened to remove COVID-related funding and other support at the time when they needed all the support that they could get. So when we talk about long-lasting implications, I think that can be twofold. In one sense, if it's recognized that the federal government has the authority to just come in and remove these checkpoints, that could be really bad for the tribes because that's a measure that they're using to protect their own people's public health through these travel restrictions. And at the same time, it's really hurt the relationship between the tribe, the state, and the federal government. So even just those impacts on the relationships, when you think alternatively, if they used it as an opportunity to come together and form agreements to share resources, that would have been kind of the flip side of what we could have seen. But other similar issues have arisen with the reopening of casinos. We saw that in Connecticut with the tribes wanting to reopen their casinos sooner than the state's reopening plan, and the state threatening similarly to remove state resources, not allowing state personnel to work there at the casino. So it did result in a lot of controversy, but definitely highlighting the need that even though these tribes are sovereign entities, the benefits of really working together and recognizing that the virus doesn't know the difference between a tribal land, a state land, and really the need for sharing resources and for the benefit of public health.
Thank you for that very comprehensive answer, Sarah. Along those same lines, in terms of the working togetherness, we have seen during this pandemic several states that have actually taken the action of preempting localities within their jurisdiction from implementing stricter measures, reopening delays, mask requirements, etc. What impacts will that action have on local emergency authority going forward? And what harms might we see from diminishing that local authority?
Yeah, I think the diminishing of local authority that we have seen during the pandemic, I think it's something that's really dangerous. For the past decade or so, we've seen a trend in states preempting local authority to regulate in areas like housing, employment, sometimes food and nutrition. And it's usually related to these chronic conditions. But during COVID, we saw states similarly preempt local authority relating to emergency response and infection control, which I see as particularly dangerous because when we think back to the early days of the pandemic and the first shutdowns that were initiated, it was from localities. San Francisco, New York City, they were the first to really detect the threat and implement these shutdowns on a smaller scale. So then states kind of in turn, when they saw this is working, this is what needs to be done to respond to the virus, states kind of follow the lead of local governments, which is common in other non-emergency areas, but then we saw it happening also in the pandemic. But then as the emergency progressed and it was time for reopening, that's when we saw a lot of the preemption coming out, when states were ready to reopen their jurisdictions, but the local governments weren't. They said, in our city, we still have these rising numbers of cases. It's too early. We want to keep a lockdown implemented or implement a mask requirement. And I think that's important because sometimes just looking at state level data, you can overlook the fact that there's still these ongoing hotspots emerging in smaller localities. So by giving locals that authority and the ability to protect public health within their own jurisdiction, I see that as something really important. So some of these preemption, we saw at least 6 or 7 states that kind of prohibited local governments from implementing stricter social distancing measures than the states. If that's something that gets built into statutory law for the long term, that could be dangerous for future public health emergencies if local governments are really left powerless right from the start.
But Sarah, let's have a little fun with this question. Jen, with your position. So, you know, I've described preemption in many different ways. I think, Leila, you and I have too in some of our scholarship. This thing's a double-edged sword too. Let's be conscientious of one other thing that's really critical that we've seen play out nationally in so many states and frankly at the federal level too. And that is, while Sarah's right to describe localities' innovations and how much and how far they've gone to teach us a lot of what's possible and what from a public health perspective is working in regards to COVID-19 response, hey, the flip side is some localities will not do what we know works and are actually out west here, especially in our home state of Arizona and in multiple other states out west with us, we're seeing reticence, if not outright refusal at the local level to actually engage in what state health officials know will work and actually will know will make the biggest difference. You need preemption at that point. You need it to actually say, we've got an intervention from a state perspective that will work. It should work nationally, or will work across our whole jurisdiction. We're going to preempt any local effort that would suggest that we would not implement that going forward. And so face mask related requirements have been the case in some jurisdictions, various different. Closure of businesses has been hotly contested in so many states. I know, for example, in the Commonwealth of Pennsylvania back east, Governor Wolf there was very seriously contested on some of his business closure related issues, still in legal hot water over some of that from a constitutional perspective. But the reality is, at times, that preemption double-edged sword side of it suggests we actually do need a little bit of state authority on implementing over the top of contrary local objective, if but to make sure we're protecting the population uniformly. We might be seeing, very briefly here stated, and it's a theme that may carry out in my session tomorrow that we'll have as well, we actually might be seeing, of course, a movement even towards greater preemption at the federal level too. Watch for that in the decade to come. We probably are seeing a federalization or nationalization of public health response efforts during these events that we just never seen before. That could start to even preempt state and localities. Leila, anything to add on that? You and I have done some neat work on this before.
No, I think that covers it nicely. It's an important issue, and I think it's great to see questions and answers on it, and we welcome more questions related to it as well.
Yeah, precisely. That double-edged sword of preemption, how it works and where it can be to the advantage or disadvantage of public health. I think Sarah and I have done a nice job of illustrating that, but additional questions. Jen, what else is showing up?
Sure. I'll go ahead and throw in a question for Leila. We've seen the problems and the dangers that have arisen from even considering travel during this pandemic. And so with that in mind, what would you identify as the top legal issues that airports should be considering in communicable disease plans?
Narrowing it down to just the top ones, there's so many. There really are a lot of considerations. James and I worked on our reports in 2018 with the National Academies looking at these specific issues. And there are so many issues related to privacy concerns. There are issues related to recognizing CDC's authority to do contact tracing and investigations. There's legal considerations related to local and state emergency authorities and airports working with many stakeholders to recognize those authorities and working with their local and state partners. There's potentially affected with disease. And I hope you can hear me because I just got a message that my internet connection is unstable. I apologize.
Oh, you dropped off for just a second, Leila, but you're back on board.
Oh, great. Okay. I think everybody in this area is trying to use the internet right now. But there really are, a plethora of privacy and jurisdictional, legal considerations. I would say, though, the top one would be recognizing authority of the emergency powers that could be, that could have been declared in your local and state authority, and working with CDC and recognizing CDC's authority.
Hey, Leila, can I ask a real quick follow-up? Because I wanted to get your perspective on this too, and I was just curious because you and I have not discussed it, and some on our session may be interested. I saw that CDC just the other day basically rescinded its sort of mass screening program. It's not checking incoming passengers as a policy any longer in relation to their COVID-19 symptoms or otherwise. Smart, not smart, was that the right time to do it? Legally can pull it off, but should they have pulled out of that intervention at this juncture?
I have some mixed feelings on that. I think it probably would be beneficial to continue that. We've seen some evidence that the screenings don't necessarily catch that many cases. There's temperature screenings, but we've seen that people have COVID-19 that are asymptomatic, and so they may not have a fever. So the effectiveness, I can understand why they might be pulling those back, is logistically working with those airports. It's hard to pull those off. It does involve a lot of stakeholders and a lot of training. But, at the same time, I think even if they caught one person, I think that would be, beneficial. So it's definitely one of those risk benefits analysis of, how many people are they how many cases are they going to catch that way, and weighing the costs and logistics of it as well.
Sure.
And I'll pass it back to Jen now for the next question.
Thanks, Leila. I appreciate that answer. Again, for our participants, if you have any questions, please go ahead and submit those through the Pathable chat, and I will be monitoring that. While we wait for some additional questions, I'll go ahead and pose one to James. We are now in month 7 of near universal declarations of emergency across all levels of government, federal, state, tribal, local. How long should these declarations extend, and to what ends?
Great point, Jen. You know, we've been thinking about this a lot, and here's why. We're tracking, just as the network tracked the sort of massive infusion of emergency declarations across, of course, the federal level and the states and localities in that really just unbelievable 30-day period in late February, early March, when every state lit up the map, basically declaring emergencies, and thousands of localities doing the same, and literally every type of emergency the federal government can throw at it was declared. You know, one of the things we've been tracking systematically now, except at the local level where that's harder to actually keep track of the 3,000 plus localities, is who's about ready to kind of, drop the ball in relation to the emergency declarations. Which will be the first state to just intentionally, even absent sort of judicial intervention or otherwise, to make that executive choice that the emergency is over. We're working with the National Governors Association on very close tracking of that, because we're really going to be curious to see just how long the duration of these emergencies is meant to go. Jen's question is actually very precise on one critical factor: is what justifies, month 8 now, I think we're into mid-September, what justifies these long-standing emergencies for what many states, as Minnesota colleagues were mentioning earlier in one of the sessions, it's meant to be a 30-day sort of event, 30-day public health emergency, and we figure things out and move forward. We're now into month 8 and every state's still at it. It's justified. And it's justified based on the fact that so many of the interventions that you're still seeing, really work well for the purposes of tamping down on COVID-19 exposures and infections. So many of those interventions do rely on those legal declarations. And so while you may say, gosh, we're getting back closer to sort of reopening the economy completely and reopening schools, and we're seeing all this at play, think about all the different things that are still happening within your jurisdiction or locality, and you're realizing so many of these things do require upon legal support, and that legal support simply cannot be done in real time absent those emergency declarations. So just a simple example of that, for the purposes of illustration, is really easy. There are so many healthcare workers that have transferred across state lines that are doing telehealth related things in multiple jurisdictions now, all of which rely upon federal and state emergency declarations to either temporarily allow that, waive licensure related requirements, or otherwise. You just can't do these things absent those waivers in place. And those waivers depend on those declarations. I'm predicting at the federal level, this came up in one of the prior sessions too, at least some level of emergency declaration throughout the rest of the year, unquestionably. Probably public health emergency at HH level, probably President Trump keeping with the emergency declaration as we get closer to vaccination and what would it be entailed there. I think every state will stick with it through the end of 2020 as well. There really isn't a strong legal justification for pulling the emergency declaration when the events around COVID-19 remain this prevalent. So we will see exactly how far we go with what those declarations allow. But right now, there's a lot still being done in the United States in response efforts that cannot be done absent them. I hope that gives a sense of why those declarations are continuing, how states have worked hard to actually keep those going, even against judicial and legislative challenges like in Wisconsin, like in Colorado. We've seen those, but to be sure, they're sustained, they're justified, and they're surviving the political gamut of issues as well.
Thank you, James. And I would just like to add to that, this has certainly been a very interesting study in terms of demonstrating how different states actually operate in this system of a public health emergency. I did some work tracking different state extensions of emergency orders, and it's just so fascinating to see the difference across states. You had South Carolina, orders are valid for 15 days at a time. And so people might be depending, practitioners who you've talked about, providers who are practicing telehealth might be checking back every 15 days to make sure that this order is still in place. Whereas if you have, other states might have an open declaration or something that lasts more like 90 days. So that has been very interesting to follow as well.
Oh, Jen, you're right. One neat example of that too was like midsummer, mid-July or so. Do you remember when HHS was getting close to the sort of the termination of the 90-day period of this latest public health emergency declaration. It was getting close. And there was no definitive word through Secretary Azar that they were going to redeclare it for, a period of time. Oh gosh, the American Medical Association, American Hospital Association, so many others just, pleading with HHS, when are you redeclaring this? When is this going to happen? And they did it for the reason that they know so much of what they're still doing in real time is very dependent upon that specific declaration. That includes some of the most sensitive issues around liability protections that often are keyed to those declarations too. They're that essential to some of what we're still doing, and I think we'll continue that way for months to come, but until COVID is completely tamped down in many different venues. Sarah or Leila, anything you'd add on that front?
I would just say, I think when we get to the other side of this pandemic, which, we will,
yeah,
eventually, I think a lot of states will look back at what different, what they did versus other states, and I think that will be quite a consideration. I think a lot of researchers and academics will compare those as well and think about, quote unquote best practices or what, what was done in different jurisdictions. And I think that'll be really an area of research and evaluation that we will see it through.
Good point.
Thanks, everybody. So I have another question about, how these different states are handling things. A federal district court recently approved Hawaii's quarantine requirement for all incoming persons, whether or not they are known to be infected with COVID. And many states and even localities have taken similar measures. So would those actions actually be constitutional?
Jen, I'll be happy to opine on this particular front. Sarah or Leila, add in as well, but that decision in Hawaii was very interesting. This is federal district court, a decision that was issued. To our knowledge, it has not been appealed. And the decision is actually pretty favorable with what some state health officials would want to see in regards to their utilization of quarantine or isolation powers. And it kind of goes something like this. So in the state of Hawaii, Governor Ige basically issued a mandate saying, if you're coming to Hawaii, you're welcome, but when you get here, you're going to be quarantined for 14 days. Now we see multiple different states do the same thing, including New York State, who did it recently in regards to like folks from Arizona coming out to New York, even though that was done to New York residents by Florida earlier this year. You remember in March, and that was very contentious. What's the problem with it? What's the real legal issue with that? Here it is in a nutshell, and why the court's decision, as I'll explain in just a second, was really pretty controversial, and yet continues to still be largely the sort of position we're seeing out of a lot of jurisdictions' courts. Here's the issue. When you deal with, as anybody in public health knows, the implementation of quarantine or isolation, you do so based on known implementation of what's proven to be an efficacious intervention that does have some limited restriction on civil liberties, but you know it's necessary because of two things. One, with quarantine, you know somebody was exposed to an infectious condition like COVID. And if it was tuberculosis, for example, you know they were exposed to tuberculosis. With isolation, of course, you know they're infected with a contagious condition. So we've got that. And if you're infected with TB, we're going to have to isolate if you will not engage in the specific measures necessary to prevent, its exposure to others. What you're seeing in orders like what Governor Ige and frankly Governor Ducey here in Arizona and Governor Cuomo in New York and so many other states have done is basically say, we don't care what the basis was for the implementation of this 14-day quarantine period. We don't know if you were exposed. We just know we don't want to take that risk. This is really unprecedented in regards to how far a quarantine measure may be lawfully sort of based. Typically, you would not allow that in a non-emergency situation, a implementation of quarantine of which somebody may be coming into the state, have zero exposure to COVID, certainly doesn't have COVID because you can test for that quickly, and yet they're still having to observe a 14-day quarantine period. The city of Seattle tried this and did it actually early in March as well. So what the federal district court basically did is against a challenge to that in Hawaii, basically said straight up, it's legit, it's constitutionally sound. The governor does have the authority to implement this type of social distancing measure, reclassifying it, not so much as pure categorical quarantine, but more along the lines of just a sheer protection in the interest of social distancing more along the lines of business closure and less along the lines of quarantine. And I have a large, understanding of why the court would actually recharacterize it that way. But the court found no due process violations, no fundamental police power related concerns or violations. It essentially allowed that 14-day order to go through, even against the backdrop of some objection at the federal level. It's quite interesting. Those decisions will be controversial down the road because, as we'll see later, traditional implementation of quarantine isolation always involves some finding of actual known infection or exposure to infection. And we can't just presume it usually. You're seeing a difference with that with these social distancing measures. It's a great question, Jim, because it does raise some really confound constitutional issues. I cannot fully predict how other states and other courts will necessarily see those a month from now, 2 months from now, but in the throes of the emergency in a state like Hawaii, they found it agreeable. Leela, Sarah, anything you'd add to that?
Just that what's really interesting is, I think if we think back to, say, January or before the pandemic really started in the United States, at least, this is an example of something, these broad blanket quarantines that we would say pretty flat out that's unconstitutional, right? You need an individualized assessment in order to deprive someone of their liberty interest like that through a quarantine. But now, today, months later, that's something that we're kind of rethinking, saying, oh, maybe it is necessary to protect the public health. So that's just one of the many ways that COVID has tested our public health system and made us really rethink about what is a constitutional deprivation of liberties to protect the public health.
Great point, Sarah. And just, further seeing the stay-home orders and other initiative business closures, all of this precipitated by the need to control for something that, absent these interventions, we simply would have had hundreds of thousands more deaths in the United States. Everybody knows that. But the sheer reality is we have had to rethink what these public health powers actually look like and would be constitutionally sound, maybe for the future as well. Leila, anything you'd add?
Yeah, I think besides just the constitutional discussion, it highlights, what we talked about earlier in this segment related to airports, because those airports are especially for a place like Hawaii, they're the ones that are receiving the passengers and that have to be aware of the, what's happening at the local and state level and the authorities and quarantines, because they're the ones that will be the, first to interact with the passengers as they arrive.
Mm-hmm. Oh, Jen, I think you might be on mute still. That's happened to me.
You're right, I was on mute still. That problem quickly. Thanks everybody for your responses there. Leila, following up again on the airport side of things, you mentioned earlier that it's important to include stakeholders when identifying, those top legal issues that airports should be considering. Which stakeholders are the stakeholders that should be included here?
Thanks, Jen. Yeah, there are quite a few stakeholders. Obviously, coming from the public health attorney side of it, I would say the attorneys are one of the key stakeholders to be included. But there's also airport owners. There could be a city-owned, airport or an airport authority. So the airport owners and operators are key. And then other airport entities. There's public relations is a key one that's very important when you're dealing with public-facing situations, such as a potentially infected passenger coming into an airport. There's emergency management, fire, rescue, even concessions. Everybody who might have some interaction at the airport. And then there's, of course, very vital collaboration with public health entities, local, state, federal, and that collaboration obviously is unquestionably vital and important. And then local, even just not perhaps fire that might be just at the airport fire department or law enforcement that works specifically with the airport. There might be law enforcement that work in the surrounding areas that need to be involved as well. And hospitals, if patients are being transferred to a nearby hospital, they also need to be able to be in discussions. Thanks, Jen, for that question.
And Jen, conscientious of time, why don't we take maybe one last question? We'll wrap up with some good final thoughts from all of us. Go ahead, Jen.
Thanks, James. One final question. So it seems like constitutional debates over the limitations to assemble due to COVID-19 have shifted from churches to protests to political rallies. Is there any difference constitutionally between these gatherings for the purposes of public health limitations?
Ooh, that's a neat one. Can I take that on initially, and then Sarah and Leila, add anything else you want into it? That's been one of those dominant questions. We've gotten a lot of stuff over the last several months on. We've had webinar topics on that. And remember, all those webinars back on our network website, if you're looking for more information on some of the constitutional concerns, we had a great webinar on just those issues alone. Oh, it makes a difference what the setting is, what the concerns are, but it's not necessarily, at least in my view, and yet we'll actually introduce to you a very new case just out of Pennsylvania here in a second that I was mentioning early, that's actually shedding some very different perspective and light on it. The ability to limit a right to assemble, whether it's for different settings in different environments, is largely not changed based on the public health basis. So when you have a strong public health measure or incentive to actually limit rights to assemble, it's the public health basis that actually comes into play, as the Supreme Court's clarified, time after time. The public health justification for limiting rights to assemble is a true and legitimate justification, no matter what the reason is to assemble, right? So if it's within a church-related setting, even just recently, Chief Justice Roberts made clear in the U.S. Supreme Court case earlier in May this year, hey, we will limit what needs to be done, and we will allow for closure of churches and other types of religious assemblies. Back in May, he made that quite clear again, as the court has done on multiple occasions. Political protests, issues related to political rallies, issues related to business closures, all of these can be limited via public health justification against a backdrop of a fungible right to assemble that exists under the First Amendment. The difference becomes not so much what the capacity of the First Amendment to bend and flex is, at least not what I'm seeing in the jurisprudence. The difference is, what are the distinct public health risks to each setting? And that's one thing we've learned a lot about, haven't we, over the last several months. We do see very distinct risks that underlie, gathering in movie theaters, as contrasted with gathering in religious enterprises, religious entities, as contrasted with political or other protests that march down streets in, all of the American cities that we saw over the course of the summer, as contrasted with political rallies that are starting to occur. These are different risk settings. The public health justification diverges depending on the risk setting, not so much on the public health basis. In other words, we have the capacity to shut things down or to stop things from an assembly perspective, but we need the basis, sort of grounded in what the public health intervention would be. Stated alternatively, if we have public health basis that's sufficiently strong to limit that right to assemble, the First Amendment does allow for that, no matter what that assembly type of intervention is. It's the actual public health reason that becomes the problem. Thus, to Pennsylvania and to the case, County of Butler versus Wolf, that literally just came down from the Federal District Court in the Western District of Pennsylvania, literally, I think 2 days ago. And what that court did there in contesting Governor Wolf's implementation of congregate gathering limits, the sort of things within Pennsylvania where Governor Wolf made clear no more than 10 people together in any specific setting in a specific period of time, that court in the Western District of Pennsylvania, pursuant to a county level challenge of state power in federal court, basically told Governor Wolf, you didn't have the right to do it. Your intervention from a First Amendment perspective is unconstitutional. And the basis for that decision, surely to be appealed, literally under works as we speak, is that those specific interventions simply weren't narrowly tailored sufficient to accomplish the public health objective. Simply limiting all gatherings of 10 persons or more within specific settings was, said the court, insufficient for the purposes of meeting a constitutional standard that at least has to show some tailoring under scrutiny-related basis. It's a fascinating decision because it's wildly divergent with what you're seeing even at the U.S. Supreme Court level, but will and how far will it go in regards to restricting what states can do in the future. Interesting decision. County of Butler versus Wolf. Let us know if you want a little bit more insights on that particular decision. We'll be happy to brief it for you later as well. Leila or Sarah or Jen, any further comments to that particular series of observations? Great, I nailed it then? Excellent. What I can assure you of is this, give us your follow-up in relation to those specifics. of what you're experiencing, what the judicial challenges are, what the legislative challenges are to constitutional other concerns as per the First Amendment, and let us, digest that and think through some of what and how it may work in your specific jurisdiction. But at the federal level, from what you're seeing, decisions like what I just mentioned in County of Butler versus Wolf, divergent with general mainstream jurisprudence on the scope and limit of right to assemble within the United States. All right, so without further ado, conscientious of your all's time and with thanks to all of our participants, let me, if I may, cap our session. First of all, I wish we could do our typical round of applause. Special thanks to Sarah, to Leela, to Jen for walking through all of these great questions and comments throughout the course of our Q&A session in the Western region. Second, you're seeing at the bottom of our screen our pictures, our email addresses where you can reach us. I entirely encourage you to do so with any additional follow-up questions. Did we not answer what you were hoping us to? Let us know. We will follow up with you. And if you've worked with our Western region before, it'll be in real time. You will hear from us in close proximity to your specific stated question. Email us, go to the network website, check for some of what I was mentioning to you in our document earlier about our primer there. You may see the answer to what you're interested in contained within the slides that we've got within the primer itself. For our purposes, though, keep us posted on your questions throughout the duration of this specific event. We're not at a midpoint. We don't know where we stand in relation to the COVID pandemic. What we do know is this network and our Western Region office will be there to address your questions in real time for the duration. So let us know. Special thanks again to all of our Western Region colleagues, to all of you all across the United States that joined us today. Thanks for spending some time with us. Keep us posted on your additional efforts. We'll look forward to that. And without further ado, we'll draw our session to a close. Enjoy the rest of the summit tomorrow. We will look to see you there. Have a great one. Thank you.
Thank you.